Hello everyone and welcome. This week is all about knee pain, some common causes of it, information that you need to know about knee pain and common knee surgeries, as well as later on this week we'll be diving into how movement can help all of this. So first I want to give you some information about your knee joint and how your knee joint functions so that you have a good understanding of it and we can use that information going forward. So let's get oriented with some anatomy. All right, so most of us, if we've experienced knee pain in the past, we've had it in the outer knee, the inner knee, the front of the knee, or the back of the knee, right? Those tend to be the 4 different areas we can feel it. So we're gonna break down how those are connected from a muscular standpoint. So every muscle in your body has a muscle that works opposite of it. It's kind of like a tug of war that's going on. So an example of that would be this outer system and this inner system, right? And ideally those two things are tugging at the same amount. And if one side starts to tug a bit harder than the other, that's where we can get this outer knee pain or inner knee pain. So let's look at some of the muscles that can contribute to that. So along the outside of your leg, you have a muscle called your gluteus medius. It connects into something most of us have heard of called your IT band, right? And some of your quads and hamstrings also attach into this, and that's important too. But for now, we're gonna look at this gluteus medius muscle and your IT band. And what I want you to notice is that the IT band goes and inserts right into the outside of the knee, which is a really common area for people to get outer knee pain, okay? One of the common causes of this outer knee pain is some irritation of the IT band right where it goes into the knee. Now, the good news is movement and exercise can help this, which we'll get into later this week. And often what that involves is addressing this outer system. And because we know it's just one side of the tug of war, this inner system too, okay? So let's break down a little bit of what this inner system is composed of, because maybe you've experienced some inner knee pain before. So we actually have 3 muscles that go and insert into the inside of our knee. This muscle is called the gracilis. It's a groin muscle, basically. So if you've ever had a groin strain or some groin pain or groin tightness, you'll be familiar with that one. This muscle called a semitendinosus, which is one of your hamstring muscles. You actually have 3 hamstring muscles. One of them goes and inserts right here. And then this muscle called the sartorius that kind of wraps across this thigh, going from one side of the body to the other side of the body. So if any of those three muscles have some tightness or some tension or a strain or something like that, what can happen is they can start to interact with this inside of the knee and causing inner knee pain. So again, what we want to look at from an exercise standpoint is addressing both this inner and outer system, okay? Something that's really important about this inner knee pain, which is going to tie into some of these surgeries I'm going to talk about, is a lot of times inner knee pain, if you Google this or maybe you go to see someone about this, a common diagnosis that people will get is a meniscus strain, okay? Interestingly, let's talk a little bit about meniscus surgeries. So a lot of the recommendations are changing about meniscus surgeries because they're finding that for a lot of people, not all people, but a lot of people, it is okay to have this sort of finding, and it doesn't mean that you have to have surgery. Now, of course, talk to your medical provider about this, but it's important for you to know, and you deserve to know, that the recommendations around this are changing to where a lot of people are able to avoid this having this type of surgery, because we know that that's not the only thing that can cause knee pain, and we know that these things can improve with time. So again, this inner knee pain a lot of times gets diagnosed as meniscus strains. Oftentimes it's actually a muscular thing going on, and that's often why people can avoid this surgery. And of course, talk to your provider about that if you have questions, okay? Another common knee surgery is something called lateral release. What this is if someone's having knee pain towards the outside of the knee, they'll do a surgery where they go in and make some changes on this outer aspect. The idea being it allows the patella or your kneecap to track better. A lot of research is now recommending that this surgery, or basically saying that this surgery can be avoided a lot too with the right care plan. And there's a lot of reasons for that, but one of them being we know that the muscular system is so important and can change so much with movement and the right plan. All right, so we've talked about outer knee pain, we've talked about inner knee pain. Let's talk about pain in the front and in the back a little bit. All right, we'll start with the back. So your knee joint actually rotates, okay? So if we were to look at your knee joint when you're bending and straightening your knee, there's some twisting that happens in the knee, which is a good thing. That's what allows you to turn when someone says your name, pivot, things like that. and it's controlled by a muscle in the back of your knee called your popliteus or popliteus, depending on how you want to say it. And it is directly paired with a muscle in your hip that rotates your hip. So say, for example, you're standing, someone calls your name behind you, you go to turn around. Both of these two muscles are controlling you rotating and turning in space. Now, what can happen is if someone has some irritation in this muscle, several things can happen. One, they can have some intense pain in the back of the knee. Two, they can have some really loud and uncomfortable popping that happens in the knee because that knee joint is trying to rotate and can't quite do it, and so they get a loud pop. Or three, they can start to have some pain towards the outside or the inside of the knee. Again, that's why we have to be really careful when we're diagnosing causes of outer and inner knee pain, and we don't immediately jump to this, because this can be something going on. So what a movement plan will look like for this is teaching you how to rotate your knee joint in a really smooth, pain-free way, and then often including some hip rotation exercises too, because it's important we take a really holistic view of this and kind of address the whole system. Our body doesn't really work in isolated contractions. All of these muscles are contracting together at the same time, so it's important that your movement plan takes that into account. All right, so now let's talk a bit about frontal knee pain. So right here you have your kneecap. There is a ligament underneath here called your patellar ligament, and then you have your patellar tendon. That's because a ligament attaches a bone to a bone, a tendon attaches a bone to a muscle, right? And so some people can have pain in this frontal area, or even if they have pain for a long period of time, they can get a little bit of a raised bony area through here. That's called Osgood-Schlatter syndrome. And so what we want to look at here is if we have an irritation of a tendon, we have an irritation of this ligament, this is where a right exercise program is really going to be beneficial for you. What they found, interestingly, is many years ago, they used to think that pain came from the kind of joint or the surfaces of the cartilage, and that's why they would do a procedure called a knee scope, which was going and cleaning up the cartilage. They've now found that that's not actually what's causing pain for people. It's not actually the cartilage that's causing pain. There's other aspects of the knee structure that cause pain, and that's why this surgery is also having a lot of changes and is often avoidable. And by having a lot of changes, I mean there's a lot of research coming out that this knee surgery is actually unnecessary. So if you've been recommended this knee surgery, I recommend talking to some people about it and kind of seeing how the literature has changed about this, and seeing what you might need for your knee pain and how you might be able to avoid this surgery. Okay, and then another really interesting thing coming out about knee replacements is there was a research study done that compared a knee replacement group to a placebo group. So one group of people thought they had knee replacements, one group of people thought they had knee replacements and actually had a knee replacement, and the outcome was the exact same. So it tells us that the knee replacement is, in at least in this study, was the exact same to placebo, which tells us that, you know, is it the replacement or is it really other things going on, right? And so this is why I want people to have this information, is that a lot of times this surgery can be avoided in some cases too, okay? So that gives you a good general kind of lay of the land of your knee joint and how it functions. A lot of times knee pain has to do with movement, exercise, balancing out the muscles and tendons, that sort of thing. The last thing that I'll kind of end with is if you're someone that's been diagnosed with pain in the front of this area, patellar tendonitis, I'll be posting some things later this week about some new research coming out about tendonitis and what things you can know about how to help heal the tendon, and also what are some things that you can include in your plan preventatively. Say maybe if you've suffered with knee tendonitis before and you really don't want to have to deal with it again, we'll talk about some strategies that research is showing can help to reduce your risk of it. All right. Thanks everyone for joining in as always, and I will see you next week.